All right, so to start perioprobing, first I'm gonna position my patient. I'm gonna start in sextant 1. So to do that, I'll establish my modified pen grasp on both instruments. And first, I would go in and just kind of retract this cheek, and I'm gonna fulcrum extraorally. And then I'll go in with this probe here, and I would insert at the distal line angle, keeping my fulcrum on these teeth, keeping the family together. Insert at the distal, keeping parallel to the long axis of the tooth. And then I would do my 1 millimeter bobbing, walk back, 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 get into the coal, kind of angle, insert, get that reading, pull out, and then I would insert back at the distal and walk, 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 bob, 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 adjust my angle as I go, get into the mesial, angle, push, get that reading, pull out, move on to another tooth. So I did a molar, so I'll do a premolar, and I would be positioned at 9 o'clock, maybe even a little closer to 8 o'clock, so I get a really good angle. And your fulcrum will move as you move teeth. So I would fulcrum on the incisal arch for a premolar. And I'm working on my modified pen grasp. I keep flexing my thumb, but you would keep it in your soft C. And then insert at the distal, keeping parallel to the long axis of the tooth. Walk back, walk back, walk back. Insert, pull out. Insert, walk, 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 walk. Insert into the coal, get the reading, pull out. So next I'll move to sextant 2. We'll do the anteriors. And I don't need my mirror, so I'll put that down. I'll position my patient to look kind of straight up, chin down for that, and then I would be wearing gloves. I would pull the lips back. All right, fulcrum again on, towards these anterior teeth. And then get your soft C, insert at the distal at an angle, walk back, walk back, walk back until you're in the coal, get the reading, pull out, insert at the distal, walk forward, bob, 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 into the mesial, pull out. And then by the time that we get over to these teeth over here in sextant 2, we are going to start now at the mesial and walk to the distal. So I'm going to do this second tooth in this sextant. I would have my patient kind of look a little bit this way to their left, just so I can get clear on the teeth. Again, I wouldn't use my mirror because it's right on this surface. I would insert, go towards the mesial this time. Walk, walk, get in there, get out. Keep your family together, keep your soft C. And then insert, walk, 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 walk. Into the distal, pull out. And then to move to sextant 3, I would come back over here to kind of 9 or 10 o'clock. I prefer 9, actually. Right, have them look towards me. Get your soft C, modified pen grasp. You're gonna retract these teeth, and then I like to look in the mirror too, but you can get some good direct vision if you have them look kind of as far towards you as you can. You get some direct vision, but I like to use my indirect too. Fulcrum on some of these more forward teeth. Can you see what I'm seeing in the mirror?
Yes.
Can you see the teeth?
Yes.
Okay, thank you. So fulcrum here, keep the modified C, insert, walk, 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 walk to the mesial, turn, pull out, thing, insert, walk, 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 walk. Ooh, kind of losing my angles, but I'm working on it. We want to stay parallel to the long axis of the tooth. So I see I lost it a little bit. So we're gonna work on that. Pull out. Okay, we'll do sextant 6 is the same as sextant 1. It's the same technique. Your fulcrum just changes to these teeth instead. I'm not going to show that to keep the video short. It's the same positioning for these front anteriors, so I'm going to do the linguals now instead of showing that other arch again. So the positioning is very similar. It's just the patient's chin would be up instead of down. So for the linguals, you can use your indirect vision, and I'm actually going to take the cheeks off for this part just to get them out of my way. And then can fulcrum, I would be extraoral fulcruming, or maybe a little bit with the mirror on the incisal arch just to get really good vision. Can you see these teeth? Sweet. And then I would fulcrum on a tooth. We're going to turn the probe more this way so that you're not in the patient's face. And then insert at the distal, keeping parallel to the long axis of the tooth, keeping your soft C, keeping this family together. Walk back, walk back, walk back into the coal, pull out, insert, ooh, walk, 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 insert, pull out. That's that lingual. For the anteriors, I'll go back to 12 o'clock, move them so they're looking forward. And then I'll move over to one of the teeth further in the sextant so that I can show you insert at the mesial instead of the distal at this point. Keep your soft C, insert, walk, 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 pull out, insert, keeping parallel. Oh my goodness. Walk, 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 bob, 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 angle, pull out. So that's that lingual. And then I come back 10 o'clock, and then I have some direct vision on the linguals. I would have them look away. So that's really great to fulcrum. And then you have some direct vision. So I could put this down, and I would just be kind of pulling the cheeks back, keeping everything out of the way, and keep my soft C, fulcrum, and insert at the mesial. So we're on the side of the mouth, the patient's left, and you're going to insert at the mesial, keeping parallel to the long axis of the tooth. Walk back, back, back into the mesial coal, get the reading, pull out, insert, walk, 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 insert, pull out. Same with these linguals over here. You can have some direct vision, beautiful. So you would fulcrum right here, I would, and insert at the distal, and then walk back, back, back into the distal coal. And I would be pulling the cheek, retracting with the mirror if I wanted to. If these cheeks were up, I would just have this cheek pulled back. My soft C, fulcruming extraorally, and then I would pull out of that coal, then walk mesial, walk, 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 insert, pull out. And then for these incisals, I would have the chin down, my mirror here, insert at the mesial for this tooth here, insert at the mesial line angle, would fulcrum kind of on these occlusals, maybe a little bit to the buccal, and then keep my soft C, walk, 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 walk into the mesial. This is like a tough one to get, but into the mesial, pull out, insert, walk, walk, ooh, walk, 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 keeping parallel into the distal, pull out, and then I'm gonna come back to 9 o'clock, use my mirror to kind of depress the tongue, pull that back, or retract the tongue, pull that back, fulcrum up here on the incisal arch, keeping my soft C, and then I can see these teeth really nice, and I would fulcrum on my incisal arch for this hand, get my modified pen grasp going, and then insert at the mesial, walk back, walk back, walk back, into the mesial cold, pull out, insert back at the mesial line angle, and then walk, 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 walk. My hands are too close together, sorry. Then walk, 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 into the distal and pull out. And I think that covers linguals and the exteriors for all of it. And of course in the lab, I'd have my gloves, I'd have no jewelry, hair would be up a little bit more, shoes would be different, but that is my probing technique on my Typodont.